I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Welcome to this episode of IDD Health Matters. Today I have with us a friend, a longtime colleague, Dr. Carl Tyler. Dr. Tyler is the current president of the American Academy of Developmental Medicine and Dentistry and also professor of family medicine at the Cleveland Clinic. Welcome, Carl.
Thank you.
So we've talked a lot in the past about this field, and you were one of the first people I met when I started working with the AADMD, I don't know, 10 or 11 or 12 years ago. And would you just share a little bit about your perspectives, maybe how you came into the field of providing healthcare for people with disabilities, and talk a little bit about what you do at the Cleveland Clinic?
Happy to.
Great.
So how it came to the field seems to be very random and chance, but I think there is design behind it. I was newly graduated from residency, and I settled in a small semi-rural practice of 3 other family physicians. And it was a time of deinstitutionalization where people in developmental centers in the state of Ohio were coming into the community, and they were in need of primary care physicians. And unfortunately, the healthcare system at that time was very ill prepared to provide care for those people coming out of institutions. And despite a year of postgraduate training in psychiatry and 3 years of training in family medicine in Cleveland, I was one of those ill-prepared people to provide care.
I can totally relate. You know, and let me interrupt you. Talking about that particular point, do you think that clinicians now are better prepared, or do we still have room to go? What's your thought on that?
Well, there's a lot of room to go, but there are a lot of people like me actually now in training programs who are focused on training health professionals about developmental disabilities. So I think the landscape has changed.
That's great.
And you know, at the Cleveland Clinic in the family medicine residency where I am, people with IDD are a focused population that we really want our trainees to be comfortable and familiar with and competent in caring for them.
So I didn't mean to take you off of the story there.
Okay,
so I want to make sure we get back to where you were going with that. So what happened was the first vacation I had after completing residency, settling in this semi-rural area, was to go on a wilderness canoe trip. And I was in a plane, and of course, being a nerdy new graduate, I was reading medicine. And the guy next to me was a man named Neil Brendemoyne, and he was with a group called REM, and they're a large residential service provider. And he was in charge of establishing group homes in several states, West Virginia, Ohio, that area. And he was seeking primary care physicians. And so he asked me, would you be willing to, assume primary care of some of my folks coming out of mostly Apple Creek Developmental Center in Ohio? And I had to say, despite all this training, I really haven't been specifically trained in how to care for people with IDD, but I'll give it my best shot. And so I started to see people coming out of the state institution, and I tried to learn from everyone I could, from patients themselves, from clinical situations that arose, from nurses in the disabilities field, from psychologists, from therapists of all persuasion. And I
would go to the hospital library, and at that time, before the internet, all literature was in these big, thick books called the Index Medicus.
I remember that.
Yeah.
Actually, no, I don't. I'm not that old.
Wait a minute. We're supposed to be doing an honest conversation here.
That's right. Well, okay, maybe I do remember those.
So I found very little was being written for the practicing clinician about caring for this population. And after about 10 years, I decided, instead of complaining about how little is being written, you need to start contributing to that literature. So I sold my share in this small group practice, moved to Cleveland, and did 2 fellowships at Case Western Reserve University, one in aging and disability, and then one in practice-based research, design and methodology, took a teaching position, academic teaching position, started to do research and scholarship, and started to contribute to the literature, and that's where I am today.
Here you are now, right?
Yep.
So you mentioned earlier how you're seeing more people that are doing what you're doing, or more training programs, or having people that are teaching about intellectual and developmental disabilities. How do you incorporate that into the training that you provide for students and/or residents at the Cleveland Clinic?
Well, the first thing is getting institutional support, and
that's not always easy.
No. But here's the deal I made. So I'm a family physician with certification in geriatric medicine, and we're hard to come by, and all training programs are always looking for geriatricians. And so the deal I made is I'll come on board and I'll teach geriatric medicine at the residency, with the understanding that we will also do a lot of dedicated teaching about developmental disabilities medicine. And that's the deal I struck. And my series of bosses have always honored that and have been extremely supportive of this work. And so that's
excellent that you had the foresight to put that in the agreement. So what kind of things do you think are really important for, say, residents to know about this field, just at a high level?
Okay. Well, maybe I'll talk about first, kind of like, because you asked this question, how do you teach about caring for people with developmental disabilities, or what kind of structure, infrastructure? I think the first thing is you got to have people with developmental disabilities in the residency clinic practice. And so, there are models, and these were more common in the past, where just residents would do day trips to some specialized clinic about Down syndrome. And you do learn some things that way with these extramural learning activities. But, if you want clinicians to care for a certain population, they need to be in their clinical longitudinal patient panel.
Yeah, it's more than just talking about it. You actually have to see patients with the conditions to really appreciate how it affects a person's life, and how much you can do that can improve a person's life, and understand the nuances and the differences. Yeah, reading it in a book is good, but you always need more than that. Yeah.
Right. So we have an enriched population of people with IDD in our residency panel, and we invite them into our practice. Within the Cleveland Clinic health system in northeastern Ohio, the pediatricians who care for children and adolescents with IDD know about us. And so they know we're a good recipient of adolescents and young adults with IDD needing to transition to adult health care.
They must be really thankful for that, because that's one of the challenges in this field in particular. Is pediatricians typically are have some additional training in developmental medicine, and are accustomed to taking care of people with various types of disabilities through their practice. But one of the things we hear a lot is that they end up having to take, they remain a patient of the pediatrician well after they're no longer a pediatric patient, because they have a really hard time finding a healthcare provider of adult healthcare that understands how to meet those needs. So those pediatricians I know are happy.
Yeah. It's a nice relationship. So we have infrastructure, like we have templates. Some of this is very practical. We have templates for visits for people with IDD, particularly new to the practice, to get a lot of background information in an organized way. And in teaching practices, templates are helpful in terms of it both they're prompts to provide structured information into the medical record, but it also teaches what you need to ask for and what's important to know about. We have, very simple things like a template. We have special kind of medical history forms that we send to families for transitioning, young adults with IDD that the parents complete in advance of that first appointment. We make a lot of effort to make that first appointment experience a good one for everybody, for the individual with IDD, for the family, and for the learner, the resident physician.
That's such an important aspect of this, because many times we have, the physician-patient relationship. But for people with IDD, often there's a third or sometimes a fourth person in the group. It's a family member, or sometimes it might be a supporter that's not a family member, and they are part of that healthcare team and that experience, and you've got to facilitate communication between all of them and have a good experience for all of them. And unfortunately, I bet sometimes people come in a little bit jaded because they're expecting it not to go well, because they've had so many challenging experiences accessing healthcare for people with IDD in various clinical settings because of the lack of training and people not understanding how to do it. So it's probably a breath of fresh air when they come in.
Yeah, and you're exactly right. Sometimes these first appointments, you have to undo some harm that's been done. A lot of parents have had experiences of being told wildly inaccurate prognostications about the health, the function, the life expectancy of their child. So they distrust the medical system, and they distrust the judgments and opinions and prognostications of physicians. So a lot of the early appointments are about establishing trust.
Yeah, it's very, very important with any healthcare situation. So, all right, so that's, you told us about your background, you told us about the work that you're doing at the Cleveland Clinic. What happens to residents, or what do you see when residents finish your program and have had that type of training? Do you see that? Do you know where they go? Do they end up being more welcoming of patients with intellectual and developmental disabilities into their practices?
So as a researcher, you're prompting me to start to do some data collection, and I need to start doing that in an organized way. But what we hear from our graduates, some of who stay and actually work in the Cleveland Clinic health system, and then some of whom, return to their, hometown, which is pretty much anywhere in the country.
Sure.
Or military. What we hear is that they do feel confident about taking care of people with IDD, and they get involved with things like Special Olympics at their community level. And so, yeah, we should probably do more.
I wouldn't put you on the spot there by any means, but that is so important, and it just makes the case for the value of training on anything. I talk about this a lot. If you I'm a family doc. You come to see me for eye surgery, you're going to have a terrible outcome because I have no training or understanding about how to do eye surgery. So, if we're not trained in something, we're not going to necessarily do the best job. And, there was a study that came out in 2021 showing the ill preparedness, basically, of clinicians and how they self-rated themselves as not being very confident that they were able to provide the same level of healthcare to people with disabilities and as they could with people without disabilities. And many of them didn't welcome them into their practice. And that's alarming because there are millions of people with intellectual and developmental disabilities out there. And I think as a society and as a healthcare society, we need to train people to meet the healthcare needs of everyone. And that includes people with disabilities.
Right.
Which leads us real quick to AADMD. You want to talk about AADMD a little bit? Who they are and what they do and who you are in the org?
Well, AADMD is how we met.
Yep.
And so it's a wonderful meeting place and support for physicians, dentists, and other health professionals who have a special interest and passion for people with IDD. And primarily, the American Academy of Developmental Medicine and Dentistry is an organization whose mission is to improve the health and healthcare of people with IDD through education and through advocacy and policy and through support of health professionals who focus on this population. And so AADMD spends a lot of effort with attracting students in the health professions to become aware of this population, to be interested in being change agents to improve healthcare in whatever field they're in. There are student and resident chapters of AADMD affiliated with dental schools, medical schools, and residency programs. And there's webinars, particularly directed to the student and trainee population. There are continuing education programs, webinars. We have one ongoing one in neuro IDD. There's a lot of advocacy that our organization does. So particularly during COVID, when there were some elements in our society which sadly were trying to exclude people with IDD from healthcare if they got COVID, we have a robust policy and advocacy committee headed by Dr. Emily Johnson, who and her group address kind of emerging and urgent advocacy needs relating to people with IDD. We're now starting to extend our outreach globally. So even though it's an American Academy of Developmental Medicine and Dentistry, we're very interested in how people around the world with IDD are treated and how can we support health professionals around the world. AADMD provides a home for people like you and me. So, when I first was, getting into academic medicine, I was counseled by some people, not my academic mentor, but others who were saying, oh, you shouldn't be focusing on that population. You should be focusing on diabetes or something else. And my mentor, Dr. Steve Zazansky, Dr. Jim Werner, and my mentors at Case, they were very supportive of my focus on people with IDD, and it's so when you're passionate about a certain population and many of your colleagues are not, it's nice to have a professional home
where people like you and me can talk, and we understand each other. And
that was huge for me when I finally found AADMD, and the first meeting I went to, and I began talking to people, because I was very isolated in what I was doing, and thought I was actually in some ways I thought I was the stupidest doctor ever, because I'm like, how did I not know how to provide healthcare to people with IDD? Why is this so complex? When I first started in this field. And then I went to AADMD, and I realized that the story that you told about how you got into it, my story about how to got into it, is all, so many people had that same story, because we unfortunately don't have the training pipeline that we need to have to train clinicians about this field. And while it was comforting to know that my experience was similar to others, it was also, it's part of what lit a fire under me. It's like, we've got to do something about this. We've got to figure out a way to provide training and education, and it's going to take a lot of people doing a lot of different things. And AADMD does some great work in that area, and getting training into medical schools and helping support that through grants. And so if you're a medical student, if you're a healthcare provider, a dental provider, dental student, look at aadmd.org, and there are tons of resources available, and it's great opportunities to join and to network with other people.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So, Carl, I'm going to throw in one last thing here. I like to do something called 3 in 3. So it's 3 things in 3 minutes that you'd like to tell the audience that you think can improve healthcare, improve health and wellness, or improve the world for people with intellectual and developmental disabilities.
Okay. I'm greedy. I want so much more than 3.
You can get 3.5. How about that? No, go ahead.
So, I think the starting point is that people with disabilities are part of our community, and that everyone with and without disabilities has intrinsic value and deserves health care, good health care. And as part of that corollary, health professionals need to be trained in caring for people with disabilities of all type, including intellectual and developmental disabilities. So it's, I guess, what we need is to have some core values about the intrinsic value and dignity and worth of people with and without disabilities.
Seeing people with IDD as people first, basically. Recognizing them as having the same desires, values, wants, needs, and interest in a good quality of life as anybody else.
So that's number 1, because everything flows from that.
Yeah.
I think number 2, I'm putting my geriatrician cap on,
Go for it.
is examine the drugs, blame the drugs, consider how to minimize the drugs. And so too often I see adverse health consequences from poor pharmacologic management. And it's a dynamic process. It can be a simple or a very complicated process, but a very active medication management kind of approach to healthcare is so important in this population, particularly when many people are not able to easily communicate side effects from medications, and are often prescribed medications, many medications, for clinically reasonable things.
I totally second that. I mean, that is such an issue in many fields, including the aging, but also in people with IDD. The overuse of or overprescribing of medications, people being on medicines that they've been on forever just because they've been on it without knowing if there's really a good reason for it. And then you throw in all the side effects and the complications and what you said about communication. I mean, that's a great thing for everyone out there to think about and to remember. And medications there are good reasons for them, but you have to use them judiciously and with caution and with understanding.
The third thing that comes to mind in terms of kind of principles of care is be a good listener, be a good observer, and listen to the patients, listen to what they say and don't say, and what they say indirectly or behaviorally. Listen to their care providers and their families. So part of that is being humble.
Yes.
And
yes.
People know their bodies, families know their children and family members, and care providers, direct support professionals, disabilities nurses know their patients and their clients, and listen to them. And you may not understand or have a ready way to pigeonhole or categorize or organize what they're saying, but don't forget what they're saying, don't forget what they're telling you, and learn from your mistakes. That's the half. That's the half.
Good, you go.
Learn from your mistakes. When you finally realize something, maybe later than what you wanted to, kind of learn from it. Yeah. And this is a journey. Providing care for people with IDD is one of the most challenging and complex things that a health professional can do. And that's in part why I like doing it, because I like challenges. And so keep on learning. If you're not learning, you're forgetting. And keep on learning from every experience, every encounter, every success, and every failure.
What a great way to end. And if people want to learn more about what you do at Cleveland Clinic, what's the best way for them to find out more info?
You can email me.
Okay.
My email is catyle@ccf.org, and either I or my right-hand research coordinator, Lynn Meow Peters, will answer you and see how we can be of support and service.
Excellent. And the last thing I'll say is you've got a great book. It was one of the first books I was able to find.
Intellectual Disabilities at your
fingertips.
Yep.
Yes, great book. It's had a couple of editions, and it's being turned into an app, right?
Yes.
Highly
next
recommended.
Couple months.
Highly recommended if you're in this field. Carl, thanks so much for joining me today. And
My
I look forward
pleasure.
to talking with you again at some point.
Thank you. Thanks.